Hi there, I'm Jonathan, and on behalf of my bodywork partner Alex, we're here with another educational video for you today. Today we're specifically going to be looking at one of our foundational principles in the bodywork system we've developed known as Integrative Bodywork for the manual therapist. We're going to be looking at joint mobilization. In order to better understand what a joint is, we are defining it at the place where two bones meet or articulate, allowing for movement in the body. I like to say that joints allow for movement. It's the muscles that actually create the movement at those joints. That's why we always refer to it as the musculoskeletal system. So before we look at the technique specifically, we'd like to take some time and classify the joints we find in the human body. Throughout the body, we essentially have three classifications of joints. First, we have fibrous joints, in which two bones are held together by strong fibrous connective tissue. There is very little movement here, and though we feel movement between these types of joints as possible, it is so incremental that most sources refer to them as fixed. Think about the cranial sutures linking together the bones of the skull. Next, we have cartilaginous joints. These joints are exactly what they sound like. They are joints that are held together by cartilage. We have more movement capable here and more necessary here than in the aforementioned fibrous joints. Here, we would like you to think of the intervertebral discs found between the vertebrae or even pubic symphysis. Lastly, we have synovial joints. These are the most common joints found in the body, and they also allow for the most movement. In these types of joints, the two separate bones are surrounded by an articular capsule and also include a synovial cavity which contains synovial fluid for the purpose of lubricating the actual joint itself, which reduces the creation of friction in these two bones that make up the specific joint. While there are so many examples, consider here the tarsals and metatarsals or even the iliofemoral joint. So now that we've defined what a joint is, we'd like to take a look at the technique known as joint mobilization, or as we like to call it, the business of oscillation. We've already stated that joints allow for movement and that the muscles create the movement in those joints. So here you might be making the assumption that we're just going to put a joint straight through its range of motion, but that's not really the case at all. We're looking at creating more intrinsic movement in between the articulations themselves to hopefully create a greater pain-free range of motion for our clients. So in order to get a greater understanding of what we mean by joint mobilization, I'm going to demonstrate out this technique on an often overlooked joint here in the lower leg, the tibiofibular joint. Now, my point of contact on that fibula is going to be here in my soft fists. The flats of the phalanges is what I'm going to be using to contact the fibula itself. We've talked about the tools I'm going to use, again, soft of the fists here. I do want to take a moment and mention, you can notice that I'm not using a bolster under the client's leg. I can't recommend this enough. The table, the surface area, the solidity here is what we need for this technique. We don't want too much give underneath us. So I'm going to square up. I'm going to actually not guess. I'm going to palpate around the fibula. And as I make contact, it's my body weight that's sinking in over my fists in order to get to that first resistance barrier. So there's my starting pressure, Sean. How's that feeling for you?
That feels good.
Okay. Once I feel like, again, that I've got good solid contact, my client's all right, I'm going to create a bit of that oscillating movement. Now, it may be hard to see here at first because I'm starting slow. Try to think of this more as a back and forth movement, but I'm never releasing the hold or the pressure that I already have into the table until I move downward get more contact again with the fibula, and start the process all over. So Sean, now as I'm adding some movement in that fibula, what do you think? How's it treating you?
Yeah, feels fine.
Okay. Good. And we keep moving. I think it's really important to remember here. I know that the peroneal muscles are right on this fibula, but I'm not using compression of the peroneals. Yeah, I'm down in that bone, and now I'm really starting to get some great movement. Yeah, down in that fibula, freeing up this joint. Okay, Sean, this is the place that feels most stuck. Do you notice the difference at either end?
Definitely.
Okay, so I'm going to spend just a few more minutes, maybe not full minutes, but seconds here for sure. And I'm going to slow my pressure down. And that micro movement that's happening there is really working to release and mobilize that joint. Again, I'm going to come out kind of slow here. Let it all up. And you can take a look at the actual fibula itself here, or this area, and see that I've been here and done some work. It's really a great way to look at joint mobilization. I want to stress to you, we're about to move into some other examples of this technique. The essential principles for what I've shown you here at this joint apply to all the variations you're about to see. Clearly, we can see how valuable an idea like joint mobilization is in our sessions with our clients. Joint mobilization can be used as an assessment tool, as an integrative technique, as well as a standalone technique for those problem areas that you're dealing with in your sessions with your clients. It is so important to remember to stay focused while using this technique and to use pressure gauged movement in order to create oscillation between the two bones. We also want to remind you that these are not high velocity thrust adjustments. That way, this cannot be considered a chiropractic adjustment nor classified as one either, and we want to stress that they should never be applied in such a fashion. Even so, we want to take a minute here at the end of this video to remind you to check your local regulations and to make sure that this idea and technique fits in to your scope of practice for your particular discipline as well as your local rules. Thanks again for joining us today. I'm Jonathan. Stay integrated.
Yeah. Anatomically specific.
Holistically focused. We are Integration Nation.